Good day. My name is Rosina Clark Turner, and I'm a senior implementation consultant here at Axxess. And I'm delighted to present with my co-host this afternoon regarding the Hospice PECOS requirements. Karen, go ahead and introduce yourself.
Hi, my name is Karen Chamberlain, and I am a product support manager for Axxess.
We have been tasked with the pleasure of inviting you to share with us in the Hospice PECOS requirements, specifically the provider enrollment chain and ownership system, PECOS, or PECOS if you're in Texas, that will put into place as of June 3rd some of the requirements of the CARE Act. So our objective today is really, apart from introducing ourselves and user access for this expose, is to hopefully give you a little bit more understanding of the Hospice PECOS requirement. We're going to spend some time talking a little bit about the upcoming functionality changes that you will see. Karen's going to spend a lot of time talking about how to access information that will further allow you to be in compliance and looking at really in a global kind of view, those kind of key considerations that we need to take to put in place in reality because of what this requirement means for us. And then, of course, as we end, we will be sure to give you some resources that will hopefully be useful for you operationally and to ensure your fiscal integrity based on the implications of these requirements. Thanks, Karen. Okay, so basically, what are we talking about? It's kind of really simple. It is this requirement for physicians who certify the need for hospice services initially and with recertifications to be PECOS either enrolled or to have opted out of Medicare. Now, what does opting out mean? It's kind of really simple. They have to be registered, but what they're saying to Medicare is that in reality, we do not intend to bill for the services. Karen, is there anything else that you'd like to clarify regarding being enrolled and opting out, validly opting out?
Yes, the new requirement requires that the hospice certifying physician or the attending certifying physician is either PECOS enrolled or opted out. So again, what does that mean? When a physician is opted out, that means they don't want to bill for their professional services, but they're still allowed to certify for those patients.
Yep. Absolutely, absolutely. And the whole process, there will be information that you will get from our resources, which will be able to give specific information to those physicians who are enrolling and what the process is and the forms that they need to utilize if they have not already done so. Now, for a lot of our physicians, this is going to mean nothing has changed because they've already taken care of this. But it's just looking at what the considerations will need to be for those who are not in the position where they have already enrolled or validly opted out. Okay. Who's going to be impacted by this? In reality, we're talking about the fact that the certified physician, based on the Medicare specification of what a physician is, who is able to certify patients for hospice services, none of that is changing. It's still looking at the Medicare definition of a physician. So when we look at the role, and I know Karen is going to speak really eloquently to this, of the role of the nurse practitioner and the physician assistant, nothing's changing there. Karen, you want to elaborate on that a little bit?
Yeah, sure. What that means is that the patient can still have an attending nurse practitioner or physician's assistant. But as we know, a nurse practitioner or physician's assistant today is not allowed to certify, right? And so that's not changing. They're only looking at whether or not the provider that's certifying the patient is PECOS eligible.
Absolutely. So no change in what Medicare is intended regarding the physician involvement, and it's not extending any sort of new graces to anyone else, but it's still looking at that physician being in fact a physician. So to really summarize, what we're really seeing, Karen, is that Medicare is now enforcing the CARE Act. They moved it from May of this year to June 3rd. And so as of June 3rd, the basic concept is that except for the new enrollment or opting out, nothing else changes regarding who may certify for terminal illness. We're in sync with that. Effective June 3rd, 2024, this change is on the books, okay? So there are some important things that our solution at Axxess is doing to deal with the upcoming functionality changes. And Karen, I'm gonna let you go ahead and move forward. We're looking at what are we doing in terms of prepping on what to have this be a reality.
Absolutely. So as part of the new Hospice PECOS requirement, CMS has added a new column for hospice eligibility in the ordering, referring, and data file that will specify whether or not that provider is PECOS eligible. And they'll be scoping this file to see whether or not those physicians are PECOS enrolled or validly opted out on the claim edits, which I'll get into a little bit later. And so some of the things that we've put in place for the Axxess Hospice solution and the Suncoast solution is there's going to be updates to the PECOS enrollment functionality that will provide your agency some visibility of whether or not the physicians that are being entered in onto the client's record are Hospice PECOS eligible or if they're ineligible. We're also adding some functionality that will provide some notifications in terms of the certification or recertification documents if that certifying physician is not PECOS eligible. I want to stress the importance. It's very important to be proactive with this because once you send that claim and it's denied because the physician was not PECOS eligible, you can't go back and redo that certification. So it's very important that the physicians that are certifying the patient are PECOS hospice enrolled or opted out. Another thing that we've added is some reports for tracking whether or not the PECOS at the physician or provider is PECOS eligible. This will help the agency maintain that compliance. And then in addition, we are offering some claim holds that will provide visibility when a certification has been signed by a physician that's not PECOS eligible. The other thing I want to mention is in relation to the nurse practitioner, right? Because a nurse practitioner or a physician assistant cannot certify. So claims will report for the certifying hospice physician in FL76, which is the attending field. Now, how does that happen in the Axxess solution? That's triggered by whoever you enter into the attending physician field on that client chart. And the Suncoast solution is a slightly different mechanism, but it'll trigger the hospice physician to pull to that attending field, even if the nurse practitioner is in the attending field on the client chart. Any questions about that, Rosita? Does that make sense?
Yeah, and so it sounds like it's going to be really important that we really understand that Medicare says attending physician. Medicare means physician, not nurse practitioner, not physician assistant, that we're looking at that in terms of the attending physician. So it looks like our changes are going to impact in lots of ways. So from the physician database where the PECOS eligibility is documented, we'll be able to see that. From the patient's chart in the intake process, we'll have that visibility there. When it comes to the CTI and any sort of assignment, there'll be alerts there as well. And it seems like what we're summarizing here is that the claims process will also give alerts that will ensure compliance.
Absolutely. Okay. So where can you access this information? You can get it by email, through a Suncoast email, or through the Axxess Message Center and News and Updates. You can also see the changes, those functionality changes in the Axxess Help Center through trainings and webinars, as well as software updates. And those are listed as they occur. And then for Suncoast, you can see that in the Zendesk articles. That includes our release notes and our quick reference guides.
And Karen, I think it's going to be really important for our partners to understand that we understand there's so many alerts that come through. We've become alert insensitive. It's like that dinging bell when you're in the intensive care unit. You're so accustomed to it. But like you said, it's extremely important that you make yourself aware of what is coming down the pipe so that you can make the necessary adjustments to ensure that you're aware of what's happening. We will send you the alerts. We'll send you the information. It will be in our solution. We will really need you to pay attention to what is coming down the pipe.
That's right.
Okay.
All right. So I want to talk a little bit, though, about some key considerations that I want our customers to be aware of. And this is in particular surrounded around the claim edit, right? So beginning June the 3rd, CMS is only verifying whether that enrollment or opted out status of the physician that's listed in the attending physician field. And that's for all claims, whether that claim was created during an initial certification period or whether that claim was created in a subsequent benefit period. So it's very important to note that whatever physician is listed in the attending physician field is what that claim edit is going to be looking at. And if that physician is not PECOS enrolled, then that claim will be denied. Now, why am I mentioning this to you? Well, because a nurse practitioner will always, or a physician's assistant will always be PECOS eligible, no, ineligible, because they're not able to certify. So it's very important that when you are submitting your claims, that if there is a nurse practitioner or a physician's assistant, that physician is not reported into the attending physician field. As I mentioned previously, in the Axxess solution, that's triggered by whoever you enter into the attending field on the client's chart. And the Suncoast solution, that will be triggered by an output override that is automatically set for any financial class for Medicare. Then to note that beginning on October 7th, CMS, that's when they'll begin verifying that enrollment or opted out status of the physician listed in the other physician field. So once that occurs, CMS will check both of the fields. They're going to check the attending physician field and the other field. Both physicians, if different, will be subjected to the edit for the initial certification period. So claims that are falling into that initial certification period, they'll be looking at both the attending and the other fields. For subsequent certifications, CMS is only going to check the other physician field for the certifying physician. Should the hospice enter the attending physician in the attending field and the certifying physician in the other field, if the patient doesn't have an attending physician, then they're going to report just that certifying hospice physician in the attending field. Any questions about that, Rosina?
No, I think you've explained it beautifully. And we've been harping on the fact that we're talking about physician, and hopefully that registers. And the fact that failure to do that will result in those claim denials. Okay.
That's right. Yeah. That's the bottom line, right? What field are they looking at in the claim edit? Also, just to note, when it comes to occurrence code 27, and occurrence code 27 is in relation to, that provides the date of the certification or recertification. That field is not required, or that occurrence code is not required for every single claim. It's only required on claims where the certification took place during that benefit period. It's voluntary on all other claims. So I want to make sure I note that beginning on June the 3rd through October the 6th, when the OC 27, occurrence code 27, is on the claim, The edit will look at that date that's in relation to that OC27 and compare it to the attending physician and determine whether or not that attending physician was PECOS eligible. If that physician was not PECOS eligible, the claim will deny. If the OC27 is not on the claim, then they will look at the statement from date of that claim and compare it to the physician and the date of that PECOS enrollment for the physician in the attending field. Then beginning October 7th, the edit's only going to trigger when the OC27 is present on the claim. And as we know, the OC27 is required on claims for when that certification or recertification happened during that billing period. It's important to note that this is a forever evolving a requirement. So please make sure that your agency is paying attention to any regulatory alerts. Make sure that you're listening to regulatory bodies when it comes to those claims edit, because again, it seems to be evolving day by day.
And a testament to that has been when you look at the MLN that came out prior to just now, you're seeing that adjustments are being made based on what that ever evolving situation is. So if you're looking at MLN matters, you want to make sure that you're looking at the most current release of that to reflect with those changes or how this is progressing. Okay.
Yes, absolutely, Rosina. And there are resources out there that are available to you. One of which, of course, is the fiscal year 2024 hospice final rule, as well as that ordering referring data file, where agencies have the ability to go and look at that file and compare it to any data that they have within their system. And then, of course, that NPPES that will verify NPI numbers for your physicians.
And here at Axxess, we intend to be at the forefront of what's changing, where it's happening. You can always, we will, as changes occur, we will make sure that we're putting it to you as our partners to make sure that you are fiscally sound and regulatorily compliant.
Yes.
Karen,
Absolutely.
is there anything else that you'd like to add as a takeaway from our discussions today?
Yes, the biggest thing is that you want to be proactive. You want to make sure that you are reviewing your claim holds. You want to make sure that whenever you see a physician that's PECOS and eligible, that you're verifying that information and that you are doing your due diligence to make sure that you get your full revenue.
And be sure to continue to look at all of the updates that we will provide. You will see these alerts that Karen spoke of so eloquently in our solution to let you know that we are in this with you to ensure that things go the way they need to be. Thank you so much for joining us today. It's been our pleasure to engage you in PECOS requirements, and we look forward to your continued success in understanding as we also try to decipher what the regulations are regarding your hospice services, adequate service, quality care to our patients, and also your fiscal soundness. Thank you so much for joining us today.
Thank you.